All right, let's go over some really effective ways to address some myofascial restrictions. Myofascia just means the combination of myo, meaning muscle, fascia. So the connections between the two, there's different layers, superficial and deep. So we're gonna go over some really good techniques. All we're gonna use today is a firm medicine ball. You can use a foam roller, lacrosse ball, PVC pipe. There's a lot of different ways, but I find that the roundness of a firm medicine ball is really effective at getting deep into those tissues. If it's too intense for you when you try, ease up, use a foam roller. That styrofoam's a lot more manageable. There's soft ones, there's more firm ones. Just you want to progressively get into a stiffer, harder surface to get deeper into your tissues, to hydrate them, and to get them to be more pliable. So there's going to be a few different ones that we're going to go over. The first one is for the rectus femoris, the front side of your thigh, which gets tight. The second is going to be your IT band. Third is going to be your adductors. So for the first one, all you do is position yourself straight over that ball. And I think like this one's a little too big. So an 8-pounder is actually quite perfect. So you'll get into almost like a plank position with that ball kind of in the mid substance of your thigh here. And let that weight sink into it slowly. You don't want to do anything forceful or quick. One leg's going to be out to the side, forearms taking up some of that pressure, core engaged so you're not just dropping down. And then let your leg lift off and let that body just sink into it, okay? We're just going straight over the front of that quadricep, nice and slowly. If you want, you can add some bend to the knee and walk yourself up. Now we talk about trigger points. If you find a spot that's extremely tender, you may have to ease up the pressure a little bit, kind of come off of it. But you want to sink into that and let that tissue just kind of melt away. Let that trigger point ease up and let that fascia stretch a little bit. You might, in that position, try to bend the knee a little bit, stretching the muscle fibers and the fascia across that tightness, right across that ball. You want to do that for at least 2 minutes each side. So that's your rectus femoris. The next one's that IT band, the infamous IT band. So you'll go to your side, you'll feel your hip bone. You're gonna go right inferior, right below that. Okay? And we're going straight on it. You can go at like a 45-degree forward, 45-degree backward, which is really beneficial to get on the quadricep muscle, where it kind of interfaces on the side of the IT band, but usually I like to start straight on it. Finding that bone, just go right below it. And again, come forward and back till you feel a really tight, fibrous area. Exhale and lean. You should use your arms and your opposite foot to help alleviate some of that pressure, but progressively sink into it so that your body is able to absorb that tension and stretch out that fascia. You can work down to the outer part of the knee. If you want to really be bold, you can bend the knee a little bit, but I think that's unnecessary. And then after you've done that for about 2 minutes down the straight, do the 45-degree where you're going to the front side of the IT band where it interfaces on the quadricep, and the posterior side, which I find to be extremely involved with people with knee pain, even back pain, so that fascia gets super adhered and stuff with the lateral quadricep called your vastus lateralis. So just doing a simple roll across that tissue can be money. So that's your IT band. Third one, adductors. So the groin muscles, okay? We often don't exercise them. Most people don't work on the adductor machine like they should at the gym. Bunch of dudes don't think it's a dude exercise. They call it a chick exercise, which is silly. We all have adductors. So in addition to rolling, you should be exercising your adductors. We can talk about that on another video. But for now, what you're gonna do is get into a figure 4 position, okay? This ball's gonna go right into the middle part of your adductor, across, right in the middle part. And you're not gonna go up and down, we're gonna go more side to side. So you're gonna, again, get that chest forward, letting that knee open. If your hip doesn't have the mobility, you can stay kind of rotated up if you need. But we wanna let that leg, again, kind of sink over that ball. So that ball's pushing deep into that myofascia, deep into those tissues, and then kind of running your knee that way till that ball comes kind of up towards your groin, and you should feel, whoo, Some pretty tender areas through there. If you don't feel it just going straight east and west here, you might move that leg up a little bit or down a little bit and see if some of the other smaller adductor muscles are a little bit restricted. Boom, letting that leg, and then the goal would be then to eventually get your belly button down towards the ground, because what that's gonna do is help stretch the adductors and get that leg to open up, stretching that myofascia. So that helps with squatting, getting the knees open, hips open, so you can squat deeper, things like that. So 3 simple myofascial releases there, 2 minutes apiece for your rectus femoris, your IT band and lateral quadricep interface, and then your adductors. Hitting that 3 times a week for 2 minutes apiece over the long haul is gonna provide you with a significant amount of mobility in your hips and thighs and some good amount of pain reduction. I guarantee it. Try it out.